Hello, my amazing vitamin heroes. We are Vitamin Angels, your guide, mentor, and a friend on the journey of our children's well being. Today, we will be accompanied by our dynamic superheroes, the Immunity Buddies. Together, we should teach, learn, and understand the process of giving vitamin A supplements to our children, keeping them healthy, happy, and forever full of energy. Understanding vitamin A supplements. Vitamin A supplements can be life-changing among children under 5 years of age. 2 doses of vitamin A every 6 months helps prevent blindness, boosts immunity, reduces the risk of death by up to 24%, and even prevent illnesses like measles and iron deficiency anemia. Vitamin A supplements provided to you is in the form of capsules, and it comes in 2 types. The blue capsule has 1 lakh international units of vitamin A and is for young babies aged 6 to 11 months, while the red capsule has 2 lakh international units of vitamin A for toddlers and young children aged 1 to 5 years. In total, an infant between the age of 6 months to 5 years needs to be given 1 blue capsule and 8 red capsules every 6 months. Vitamin A supplements can be given on the same day alongside deworming and other vaccinations. In the rare cases, there may be mild side effects like nausea, vomiting, headache, fatigue, loss of appetite, or swelling on the soft spot of the child's head. These may occur in not more than 5 out of 100 children and typically resolve within 2 days. If these symptoms persist or new ones emerge, this could be due to other infections. In such cases, ask the caregiver to seek medical attention from a doctor. Child Eligibility Guidelines. Our Immunity Buddies will guide us through the necessary checklist to consider before administering vitamin A supplements to a child. When a child comes for dosing, ask the caregiver to give you the child's MCP card. Then, ask these 3 questions while checking the same on the MCP card. 1. Ask how old is your child. The child needs to be at least 6 months old and under 5 years of age to receive vitamin A. 2. When was the last time your child received vitamin A? The interval gap needs to be at least 6 months from the last administered dose. 3. Does your child have vomiting, fever, or diarrhea, or any difficulty breathing today? Observe the child's breathing. Dose the child only after they have passed the 3 eligibility criteria. Child Dosing Guidelines. When dosing a child with vitamin A, make sure you wash your hands with soap or use a sanitizer. Clean your hands before and after dosing if you have come in contact with any sick children. Use clean scissors to cut the capsule and wipe off extra oil on your hands and scissors. Use a dustbin to throw away the used vitamin A capsules. Do not touch the child. Instead, ask the caregiver to help in opening the child's mouth to administer the doses. Never force a child to take the dose. That is, do not hold the child's nose to force them into swallowing the tablets. Do not dose a crying child. Never send the dose vitamin A home with a caregiver to give it to the child later. Milestones of health and happiness. Let's learn the process. Hello, service provider. Today, we'll go through the steps of administering vitamin A to our children under the age of 5 years. It is a simple and a fun 7-step exercise. With the completion of each step, you cross a milestone, the milestone of health and happiness. Make sure you cross all 7 milestones. To safely dose a child with vitamin A, make sure you follow these steps. 1. Eligible child. Check if the child is eligible to receive vitamin A today. Ask for the child's MCP card and verify if their age is between 6 months to 5 years. Ask the caregiver, when was the last dose of vitamin A given? Cross-check the response of the child's health card. Check if the child has any vomiting, fever, diarrhea, or any difficulty breathing on the day of dosing. Observe the child and verify the breathing is normal. 2. Clean hands. Before giving vitamin A, clean your hands to prevent any spread of infection. 3. Dose selection. Based on the child's age, select the age-appropriate dose of vitamin A. For example, if the child is 8 months old, he only gets a blue vitamin A capsule. If the child is 1.5 years old and she received vitamin A 6 months ago, she should be given a red vitamin A capsule and a half albendazole tablet. If the child is 3 years old, she should receive a red vitamin A capsule and a full albendazole tablet. 4. Positioning child. Ask the caregiver to hold the back of the child's head and make sure the mouth is open and the child is calm. 5. Dosing for vitamin A capsule. Use clean scissors to cut the tip of the capsule. Pour the oil from the capsules into the child's mouth and make sure the child has swallowed the oil and is okay. 6. Discard and clean. Discard the empty capsule in the dustbin. Clean the excess oil on your hands and the scissors. 7. Record keeping. If the child has an MCP card, note today's date in the vitamin A or deworming section. Also, enter the beneficiary details in your distribution register for vitamin A dosing administered today. Remember, the child will need these doses again after 6 months. Return the health card and let the caregiver know to bring the child in 6 months for the next dose. You are now all set to help kids stay healthy and happy. You'll do a great job if you practice these 7 steps again once before the actual distribution. Until next time, keep spreading those smiles and good health.